أنا داليا الجندي.
وأنا أمينة رشدي.
أهلا بيكم في نست بودكاست.
إحنا الاتنين أمهات وزوجات وإديوكيترز، ومن أكتر الحاجات اللي دايما بتشغلنا إننا نعرف كل حاجة تخص الأطفال والعيلة وصحتنا النفسية والجسدية.
تعالوا نشوف ونسمع سوا حلقة النهاردة هتكون عن إيه. Dr.Julia Bouska. Julia knew she wanted to be a clinical psychologist from a very young age. She earned a bachelor's degree in psychology from the University of Durham in 2003, a master's of science in developmental psychology in 2004, and then started working with patients on eating disorders. From the first day on the job, she realized that this particular area was her calling, and she wanted to continue working on it for the rest of her career. She earned her doctorate in clinical psychology in 2010. Since then, she has been working with patients with eating disorders as well as extreme eating disorders that require hospitalization. She is also a lecturer and a supervisor to a wide range of professionals working on eating disorders. She's also trained in EMDR and CBTE under Professor Christopher Fairburn, who developed CBTE therapy. In 2017, she founded the Oxford Center for Eating Disorders with a colleague, and she's currently the service manager and senior specialist clinical psychologist. She has a particular interest in the impact of early childhood trauma on later psychological problems and in metabolic health and the relationship to mental health, i.e., how our modern lifestyle of indoor, sedentary living, processed foods, high levels of stress, lack of community, disconnection from nature, etc., impacts both our physical and psychological well-being. Let's see what Julia has to say today to us about eating disorders. Welcome to a new episode of Nest Podcast. As you can see, today is a very different episode because, as you can already hear, this episode is being recorded in English. Don't worry, it will be translated for all our audiences. However, it is because the guest that we are hosting today is from the UK. As you have heard from the introduction, you will understand everything about her background from the report that you had seen at the beginning. However, I wanted to speak about something very important today, which is that this issue, eating disorders in general, are something, or it is an issue that is very close to heart. I struggled with an eating disorder for much of my life as a teenager. And I wish that at the time I had the knowledge or the place to turn to understand more about my eating disorders. And only later on in life, maybe a few years back, I had tried therapy in a lot of different places until I stumbled upon Julia in the UK, and we met on Zoom, which is what we're doing again today. And she was a huge part of my healing journey for my eating disorder. And that's why I believe it's a very, very important topic. And I think Amina would agree with me as well. It is something that's prevalent. It is something that is happening everywhere around us. I have seen it in schools, the schools that I've worked at, and I continue to see it with my friends, with my children's friends. And I think it's something that needs to be addressed and understood a lot more. Hi, Julia. How are you?
I'm fine, thank you.
Hi, Julia.
Hello. Hi there.
First things first, one of the most important things to discuss here is what is an eating disorder? Maybe perhaps let us know a little bit about the types of eating disorders as well, if possible.
Yeah. So it's a really good question, actually. And it's actually something that's harder to answer than you might think, but I shall give it a go. So an eating disorder is basically where someone experiences persistent behavioral problems around their eating. So this might be restricted eating, it might be binge eating, it might be purging, and we can talk about what all of those things are, at a later point. And associated with these behavioral problems with eating, the person would experience a lot of distress. So in terms of their thoughts and their feelings around their eating, and also usually around body image as well. So if you wanted to, or any of your audience wanted to look up the different types of eating disorders, and there are many, you could Google something called the Diagnostic and Statistical Manual. And this is something that psychiatrists and psychologists and doctors use to categorize different eating disorders. And I'll run through some of the common ones. Some of them people will have heard of, and others possibly people haven't heard of. So we've got anorexia nervosa, or anorexia for short. And anorexia is where someone persistently and severely restricts their energy intake. And this leads to something called starvation syndrome and a significant drop in weight. And if it would be helpful to talk about starvation syndrome at some point, we can do. in anorexia, the person will also have extreme fears around their weight and shape, almost to kind of a phobia level, like real panic and fear around gaining weight. And within anorexia, there's different subtypes. So in anorexia, you might either severely just restrict your eating, or you might restrict your eating and experience episodes of binge eating and purging. The next eating disorder that's very common is bulimia nervosa, often just termed bulimia. And in bulimia, you'd also see that someone has significant concerns around their weight and shape, and they would also usually be restricting their energy intake. But in bulimia, you would see persistent episodes of binge eating. And binge eating is where someone eats a large amount of food in a short period of time. And the feeling, it often feels panicky and rushed and out of control. In bulimia, you would also see episodes of what we call purging or compensatory strategies. So in response to the episode of binge eating, someone might do something like make themselves sick. They might take laxatives. They might exercise excessively. And this is an attempt to mitigate the food that they have eaten, to kind of get rid of it in some way. There's also binge eating disorder, which is essentially, it's just persistent episodes of binge eating, but there's no purging. So in binge eating disorder, someone would experience persistent episodes of binging, and there's associated distress around the binging, and they might binge even if they are very, very full. And often associated with binge eating disorder is obesity. I'll only mention one more. There are a lot of eating disorders, but I'll mention one more because this one's actually really, really common. It's actually the most common eating disorder, and no one's ever really heard of it. And it's got a very long name. It's Other Specified Feeding and Eating Disorders. And basically what this is, it's a category of eating disorders where people may experience some of the symptoms of the other eating disorders, but they just don't quite meet the threshold for the diagnosis of, say, anorexia or bulimia. And this is the vast majority of people. And probably the most interesting thing about diagnoses is that in our clinic day to day, we are not sitting with the diagnostic manual looking at the specific criteria for eating disorders. It's not really like that in clinical practice, because actually most people move in and out of the different diagnoses. So you might start off with anorexia, and then you may start binging and purging, and then suddenly you would meet the criteria for bulimia, and then you may stop purging, and then suddenly you'd meet the criteria for binge eating disorder. So it's not really accurate to say that that one person has had 3 eating disorders. It's more that it's one disorder, but it's just manifesting in different ways.
Which one is the most common in adolescents, in your opinion?
I think it's OSFED, the one that I mentioned, the Other Specified Feeding and Eating Disorders. Also, actually, anorexia is pretty common in adolescents. But yeah, most people don't quite meet the threshold for, anorexia, bulimia. They have other kind of symptoms, but they just don't. The criteria actually for diagnosing an eating disorder, if you looked at the DSM, were very, very strict. You have to be binging a certain amount of times, and they're quite specific.
What are some of the main reasons behind of the eating disorders, whether emotionally or psychologically?
The most common reason that people develop an eating disorder is due to concerns around their weight and shape. And those concerns can arise for many different reasons. Maybe it's the impact of society, maybe it's social media. Very often people have been, someone's weight has been commented on, and then they become incredibly distressed around their weight and shape. Or sometimes actually people have just gone on a diet. This does happen. Sometimes people go on a diet, they lose a lot of weight, and then they become just really preoccupied and worried about their weight and shape. So yeah, weight and shape concerns is definitely very common. What's also very common is often people with eating disorders really struggle to deal with their emotional state, their just internal state. So you would sometimes find quite a common history or common thing that our patients would say is that, when I was a child, I wasn't really allowed to express my emotions, or my family wasn't a family that talked about things. And then the child essentially internalizes those emotions, and then those emotions don't just go away. You're kind of stuck with them. And then at a later point, often an eating problem can develop, and the symptoms are a way of coping with those distressing emotions.
Okay, so when do eating disorders start? Is there a specific age where we could say they start being called eating disorders, or?
Yes. So, I work mainly with older adolescents and adults, but I'd say the vast majority of eating disorders start in kind of mid-teens, 14, 15, around about that age. But I have, from my colleagues who work with younger children, I've heard that, even 7, 8-year-olds are now being referred with eating disorders. It's becoming much more common. And I've also seen the other extreme. I've seen a few people who developed an eating disorder in their 40s. I even saw one lady who developed an eating disorder in her 60s. So, but the vast majority, it's mid-teens to early 20s.
And you had said that you had said earlier that body image does play a big part. Could you let us know a little bit more about what body image is?
Yes. So, yeah, it's a good question. Basically, we're all very concerned these days, aren't we, about our body image? It's out there in social media, it's in magazines. We're very concerned about our weight, and we're very concerned about our shape. And it's simply this, it's like a preoccupation with thoughts about weight and shape. So the average person, weight and shape concerns are pretty common, actually, just amongst, most people, actually. It's very, very common. But most people might think about their weight and shape with, a fleeting thought, or they might go on a diet and then they would, come off the diet. It's not really impacting their life. Whereas someone with an eating disorder would become absolutely preoccupied with their weight and shape. They may be checking their weight several times a day. They may be checking their body. That's very common. So often people will body check. They may be persistently comparing themselves to other people. They may just be avoiding social events because they're so worried about their weight and shape. And this is what we collectively call body image, these weight and shape concerns.
So, Julia, could you tell us what role do family dynamics play in the development of eating disorders?
This is a question we are asked all the time. And as part of the treatment we offer some family sessions. And parents are often really terrified coming into these family sessions, and they often say that, So I think just the first important thing to say is that even though there are family characteristics, there are commonalities that happen in families of people with eating disorders. It's really important not to blame families because, often families come in really, really worrying about that. So the common things we would see, if there is at home a lot of discussion around weight and shape and food and eating, if parents are on a diet, if they comment negatively about other people's weights, if they're commenting about their own weight, this is really, really common. Kids in particular, they do as we do, don't they? They don't do as we say. So if they're watching that does make someone more predisposed to develop an eating disorder. Other very common things that we see are families who don't talk about feelings, or when the child experiences a strong emotion that the parents, either they just don't know what to do, or they tell the child to be quiet. Again, that's this internalizing of difficult emotions. This is so common. And then at a later point, the person may develop an eating problem in order to cope with that. Another thing that's actually really common are very highly perfectionistic families. I am really generalizing here, but really high achieving families, where everything's about academia and success and perfectionism. And particularly if you've got a child who is vulnerable to that anyway, you know, some kids just are, aren't they? Some kids are quite anxious and perfectionistic just anyway. You know, that is definitely a predisposing factor.
It's interesting, a lot of the things that you said. I wanted to point out that I remember when I was going through therapy, you had asked me once, how many times do you check yourself out in the mirror? Because I realize as adults, we don't, we do a lot of things very fleetingly. We don't realize that we're doing them. One of them is commenting about weight and, you know, things like this in front of our children. But I recall answering you with, I don't check myself out in the mirror. I don't like looking at myself. And I remember you said, okay, fine, just spend the next week seeing whether you do that or not. And I remember thinking, why is she insisting that I don't do it? I don't look at myself in the mirror. And literally the second I switched off the Zoom session, I walked out and I remember passing by the mirror, and in a fleeting second, I literally, you know, analyzed how I look, insulted myself several times, you know, made judgments about myself. And it literally took me a second. And it just hit me how these really small things that we do on a daily basis to ourselves and possibly to our children as well, just in the way we look at them when they're eating, even maybe the way we comment on the food that they're consuming, our choices when we tell them what to eat and what not to eat, all of these little things, commenting on other people around them. I think it's very important that these micro behaviors are analyzed.
They're so important. There's two things there. There's often body checking, which is what you're talking about there, happens under the radar. It happens under our conscious awareness. It's become so habitual. We've just got so used to it that we don't even know that we're doing it. And it's very common that we point this out to people and they are exactly say what you say, you know, I don't body check, you know, and then that week they notice that they're checking their body 50 times a day. But another important thing actually there is, when people are really concerned about their body, they often do the opposite as well. So sometimes people will avoid seeing their body completely. You know, they will not look in the mirror ever. You know, they will get changed in the dark. They will not let their partner see their body. And that is a fear behavior as well. So that really ramps up the panic around body image.
How common are eating disorders in adults? And how would the parent, if I'm a parent who struggles with an eating disorder, how would that impact my children?
There's lots of different statistics about how common an eating disorder is. And you'll see, you know, wildly different statistics, 1% of the population, 10% of the population. So it's probably somewhere in the middle. I don't know if we exactly know, because a lot of people don't come forward. Men in particular, actually, there's a real drive to support men in coming forward with eating disorders. So I don't think we know exactly. I mean, it feels like it's very common to me, but then I suppose that's what I do every day, isn't it? See people with eating disorders, but it seems very common. And we know that certainly the incidence of eating disorders is rising, particularly in children.
And is it also, so with men and women, is it also like, is there a difference? Do you feel like you see more women than you do men, or?
Oh yeah, yes, absolutely. 98% of people I see would be women. Yeah, absolutely. And I think this is representative of the, you know, general population. I do think that's probably an accurate representation. I think eating problems are more common in women, but there is this issue that we know that men sometimes feel embarrassed or reluctant to come forward.
So what are some early signs that parents need to look out for in their teens?
Any of the symptoms I've already mentioned. So if you notice any of those symptoms, restricted eating, binge eating, purging, obviously those are red flags. Often eating disorders go unnoticed. Often children or adolescents, adults, they're very secretive about eating disorders. So it's very common that someone may have had an eating disorder for a few years and actually nobody has noticed because they have kept it secret. And there's many symptoms you can notice as well. So if you see your child or adolescent is anxious around meal times, if they are doing things like cutting up their food or eating in a particular order, sometimes kids will eat only with a particular plate or a particular spoon. Very, very common for adolescents to avoid, going out for meals with their friends. They often become very withdrawn. There's all sorts of things. Sometimes you will notice that someone will go to the bathroom just after eating if they're making themselves sick. Or sometimes parents will say they found lots of empty wrappers in their child's bedroom. So if someone is binge eating. So there's a whole host of symptoms.
Would extreme dieting be a sign?
Oh, yeah, definitely. Yeah.
So if it's prolonged?
Yeah. If someone is persistently dieting and this is resulting in persistent weight loss, it's the consistency, the persistence of it. So as I said before, weight and shape concerns, diets, it's all very normal really within our culture, isn't it? But if it just goes on and on and on, and the person is losing weight and then they're losing interest in anything else and they're becoming absolutely preoccupied by their weight and shape, then that would be a red flag.
All right. So how does, in your opinion, social media impact people with eating disorders or with body image problems?
Social media in itself is an interesting one because I don't think social media in itself is inherently bad. We actually see quite a lot of people who will have, followed a very helpful account on social media where someone has posted their recovery journey, and they've, it's just so nice, isn't it, for people to see someone else who's been in their shoes and to see the process of recovery. So I don't think social media in itself is inherently bad. However, adolescents are on social media all the time, aren't they? Or most of us are on social media all the time. And we know that, there's a lot of accounts where people doctor images of themselves. They Photoshop images. We don't really know if what we're seeing is an accurate reflection, do we, of what someone looks like? And because we're all social creatures, we just compare ourselves to what we see, don't we? We want desperately to fit in. So I think if adolescents are seeing persistent images of people who are perfect or underweight, or just looking particularly beautiful because they've had a filter put on them, we just compare ourselves to that, and adolescents in particular. There's also actually, unfortunately, particular social media sites that are dedicated to encouraging eating disorders. I don't know if you've heard of these, but sometimes they're called pro-ana websites, where the whole point of the website is to encourage being ill with an eating disorder. So there's something called Thinspiration, where people who are extremely underweight will post pictures of themselves in an emaciated fashion, and it's about encouraging people and giving tips about how not to eat, basically. And the final thing with social media, which I think is so important, because we're constantly on social media looking at our phones, the thing is, what are we not doing? We're not spending time with real people. We're not spending time with friends so much, and all of this is so important for mental health. So I think that that plays a really big role as well.
What should parents do to prevent or reduce the risk of eating disorders?
Again, I think this comes into that issue that, there's nothing absolutely you can do to prevent an eating disorder. An eating disorder is like a perfect storm of lots of different things happening. Maybe the child had a comment at school. Maybe they're naturally an anxious person or very perfectionistic. It's a perfect storm. So there's nothing absolutely perfect that you could do to prevent an eating disorder. But things that are helpful are similar to what I said before. You want your eating behavior to be as normal as possible. So actually, when parents work on themselves, and that if at home there's not a lot of commenting about food and eating and weight and shape, and it's just more neutral at home, that is just so helpful. When the atmosphere at home is just, essentially neutral around food and weight and shape. Also give your kids a space where they can talk about their feelings. That is just so helpful. I think if children were just able to express their feelings and that was okay and they were allowed to feel the way that they feel, then I think that would have a huge impact in terms of just improving mental health in general, never mind just eating disorders. Yeah, I think they're the two main things. Apart from, I suppose if we think about the perfectionism side of things, you know, it is definitely the case that parents who push and push and push their children, if that child is vulnerable to developing an eating disorder, it's just another risk factor. So I suppose having a more relaxed attitude at home to achievement would be helpful as well.
And what about body image? How can I try to make my child's body image like healthy from the get-go?
Do you know, I think it's an absence of commenting. You know, I think there's a big move now, isn't there? There's a move now to body positivity. You know, we've moved from focusing negatively on bodies to now focusing positively on bodies. And, you know, that is definitely a step in the right direction. But we're more inclined to go for body neutrality, essentially just an absence of talking about bodies. So focusing on something else, you know, focus on hobbies and school and other interests, really for it just not to be a persistent topic of conversation, because even the body positivity movement is still a focus on our body, isn't it? You know, and realistically, you know, we feel different feelings at different times about our bodies, don't we? Sometimes we feel good, sometimes not so good. So we really encourage neutrality. And what neutrality looks like is essentially just focusing less on it, you know, not having body image as such a big topic of conversation at home. And of course, if your child...
We shouldn't be telling them you're beautiful all the time. No?
This is a really interesting one because it's really interesting. I don't think there's anything wrong with that, but it's still this focus, a lot of focus on body, is it appearance? You know, we just in our heads, it's just so hard for us to get away from it, isn't it? Because we're so focused on it. So in honesty, when someone comes in with an eating disorder, we ask parents to stop commenting around body image, weight, shape, clothing, all of that. And, you know, this is not for everyone. You know, obviously it's nice to say to your child, you look lovely, you know, and all of these things, but maybe minimize it. So it's just part of what you comment on, not, you know, the sole focus.
So you focus more on their character and on so the things that they can actually do something about, I guess.
Yes, exactly. Yeah. Focusing on other things, you know, and it's not about ignoring body image. It's just we have just become obsessed with it. I mean, it's really hard for us to imagine that we could just be less focused on it, isn't it? It's really, really, it's unusual in our society to think like that.
And what are some of the treatment options for adolescents that are struggling with eating disorders?
So I'll mention the treatment approach that we offer, but there are others. There's actually, it's probably worth mentioning that younger adolescents often have what's called family-based therapy. Now, I don't do this specifically in our clinic. We don't see younger adolescents, but in family-based therapy, it would be the adolescent and their family meeting together with a therapist. And they would be thinking about things like the physical recovery for the adolescent, so the actual eating and how the family can support the adolescent with their eating. They may also be thinking about family dynamics and, you know, things that the family could do to help to support the adolescent to recover, things that aren't helpful. So they'd be thinking about those types of things. But in our service, we offer cognitive behavior therapy enhanced, CBTE for short. And so this is the world-leading evidence-based treatment for eating disorders. And basically what it is, it's an incredibly structured treatment. So you, the adolescent or the adult, would be meeting one-on-one with a therapist for around 20 to 40 sessions. And there's a real structure in CBTE where at the beginning, you would be looking together, you'd be literally drawing out a diagram that is looking at what are the factors that are maintaining the eating disorder. Okay, so that might be body image concerns, it might be difficulties with managing emotions, it might be just your physical eating and being underweight. And so your therapist, you draw out a diagram, and in CBTE, the whole program is designed to help to break maintaining cycles of behavior. So, for example, if one of the cycles that is maintaining your eating disorder is your concern around your body image, in CBTE, you would work really, really specifically to soften the intensity of that cycle of behavior. And what you would find is over time, as people work on softening all of the maintaining cycles, you would see a general quietening of the eating disorder thoughts and feelings over time. Yeah, in CBT, I mean, I could go into a lot of depth of all aspects of it, but that's basically it in a nutshell. It's looking at the here and now. What is maintaining the eating disorder? How can we help you to soften and reduce and break the cycles that are keeping it going until it gets quieter and quieter and quieter over time?
Does it ever end?
It does end. So CBTE is 20 to 40 sessions, and it's 40 sessions for people who are underweight. So it's so that they have time to restore their weight. I think this is important to say, actually, that when someone recovers from an eating disorder, it is a psychological recovery and a physical recovery. So a lot of people will come to us and say, I want to feel better about my body image, but I don't want to gain weight. That's the most common thing we ever hear. But it's impossible. You have to do both. You have to recover physically and psychologically.
How long do you, so you say it's around 40 sessions, and then, but is it something that will, is it something that will continue, that people will continue to live with, or can it end? Can it actually be fixed?
Oh, does the eating disorder end? Yes.
Yeah. I didn't mean the sessions. No.
Oh, yeah, the sessions end. Oh, yes. Oh, goodness. Yeah, the eating disorder ends. So the common trajectory of an eating disorder, you wouldn't necessarily expect that the eating disorder would be completely gone at the end of CBTE. So you would see, basically, it's like this. The eating disorder thoughts and feelings over time would start to soften. They'd go up and down, and they'd start to soften, and then they go up and down again. It's not a smooth path. So you'd see a general softening over time of those eating disorder thoughts and behaviors. But then what you see, so after CBTE ends, we say, okay, keep working on this, because you would see what we often call lapses or speed bumps along the way. So maybe for a year after treatment, maybe for 2 years even, at a stressful time, or when someone's made a comment about your weight, you might experience a spike in the eating disorder thoughts. And, so you've got to learn how to deal with those spikes effectively and those lapses. But absolutely, an eating disorder can go away. It's really common that people come and say, I know that I'm never going to get better. I know that I can only live with this and manage it, but it's just not true. You can overcome an eating disorder.
شكراً إنكم بتسمعونا النهاردة. لو عجبكم اللي سمعتوه أو استفدتوا ولو بحاجة صغيرة جداً، ياريت تعملوا لايك وشير وسبسكرايب علشان نقدر نوصل المعلومات دي لأكبر عدد ممكن من الناس اللي ممكن تكون محتاجة فعلاً تسمعها، وكمان عشان نقدر نفضل نجيب ضيوف ذو قيمة في مجالاتهم علشان نستفيد من خبراتهم. وشكراً جداً على دعمكم لينا اللي من غيره ما كناش هنقدر نعمل البودكاست ده، اللي بنتمنى إنه يساهم في نشر الوعي وتحسين جودة الحياة لينا وللأجيال اللي جاية. تعالوا نرجع للحلقة.
The nutrition education, does it help in any way in preventing the eating disorders?
Yes. So nutrition is a really interesting one. So yes, it's really important to have education around nutrition. It's good for people to know what certain things do with their body. Why is it important to eat fat? Why is it important to eat protein? And in traditional eating disorder treatments, basically the idea is that we eat all foods in moderation. We want people to be able to eat all foods without any fear. And that is just so important. And so in the treatment, people would be exposing themselves to particular types of food, and until they feel less stressed about eating those foods, and that they can go out with their friends for dinner and all of that kind of thing. And this is a really good approach. However, I was saying to Dahlia that I have a bit of I suppose, a more controversial view around nutrition that's maybe not shared by all of the professionals in the eating disorder community. That I think we have lost our way with food quite a bit with the introduction of ultra-processed foods. So our bodies were designed to eat generally whole foods, real foods. We've been eating those foods for, millennia. I don't know how long human beings have been around, but a long time. Ultra processed foods cause people some problems with there's a lot of evidence that they cause problems with mental and physical well-being. I was just at a conference a few weeks ago where they were talking about food addiction and how a lot of people are addicted to ultra processed foods. And in fact, food manufacturers, they create something called a bliss point. So they do lots and lots of research and they make these foods literally addictive. So we see people really struggling to eat these types of foods. People literally become addicted to them. So there's a lot of anxiety around this view in the eating disorder world because there's a worry that this would create even more anxiety around food if we were to talk about this with people with eating disorders. But I think, which I can understand, but I think in a long-term view, as a kind of global population, should perhaps move in the direction of eating foods that actually support our physical and mental health, not foods that cause us problems.
I think it's a little like what we were saying about body image and not commenting negatively about food, but also not being completely okay or too positively. It's the same thing. I think we shouldn't be going for extremely unhealthy foods and saying everything's okay, or going for extremely healthy foods only, and then that would also give that sense of restriction. So I think you're right. I think it needs to be a balance.
Yeah, I think that's a really good comparison. It definitely needs to be a balance. And I think the balance has tipped in the direction of just all foods are okay. No foods will cause any problems. We've just gone too far that way. We need to edge our way back.
Yeah, because they're not okay. Even for people without eating disorders, these foods are not okay.
Well, it's
So
really.
yeah.
I mean, sometimes they're described as food-like substances, not even really food. With the emulsifiers and dyes and all the stuff that they contain, and they cause problems with physical health and mental health. So, I think we really need to think about it carefully.
And what about sports and extracurricular activities? How would they fare in terms of body image and eating disorders for adolescents?
Extracurricular activities, really good. And because as the eating disorder, there's something called the eating disorder mindset. We haven't really talked specifically about this, but basically as the eating disorder takes up more space in someone's mind, what tends to happen is they engage less in life in general. And this includes dropping hobbies and extracurricular activities and spending time with friends. And we know that you really need to add these things back in. The more you engage in other things in your life, the less space the eating disorder has to take over. So extracurricular activities, particularly social ones, excellent. Sports, obviously it depends on where someone's at in their recovery. If someone is significantly underweight, then we wouldn't recommend any exercise whatsoever. They're just not physically well enough. But as people are getting better, we would say engage in sports, team sports. What's not helpful for people with eating disorders are sole individual sports or exercise where they're maybe in the gym on the treadmill looking at the numbers. So if someone does engage in sport, definitely team sports is better. And but not all sports are that great actually, because sometimes we see quite a few gymnasts, dancers. In Oxford, we see rowers as well who have to they have to keep their weight at a certain place to be able to go in the boat. And so some sports, I think, do actually encourage people to be underweight. And, if you're vulnerable to developing an eating disorder, unfortunately, these types of sports are, they're just not very helpful for you.
So what if the eating disorders are untreated? Are there any long-term consequences that can take place?
In terms of the short term, there's lots of physical health consequences, and perhaps we can think about that as well. But long term, yes, there are some physical health consequences. So sometimes people will have stunted growth if the eating disorder started at a very early age. That's relatively common. Sometimes people will have fertility problems. So if they started the eating disorder in adolescence and they lost their period, or they didn't develop their period, that can cause later fertility issues. One long-term consequence we really worry about is a loss of bone density. So if you restrict your eating severely and you're female and you lose your periods, then this can cause something which is called osteopenia or osteoporosis, which is what older people get with their bones, where the bones become incredibly brittle and can break easily. And this is actually really worrying because this is not reversible. So a lot of the physical health issues actually are reversible, and our bodies are amazing at recovering. They really are. But osteoporosis is not reversible. And something else that's not reversible is problems with your teeth. So sometimes people who make themselves sick will, because of the acid in their mouth, they will lose the enamel on their teeth. And obviously that's not replaceable. So yes, there's some of the longer term health consequences. One other thing actually just to mention is eating disorders have the highest mortality rate of any psychological health problem. And one of the causes of this is, there's many causes, but one is hypokalemia. So hypokalemia is where we have these things in our blood called electrolytes, so potassium and sodium. And if our electrolyte levels drop suddenly, which they can do if you're making yourself sick, this can cause problems with your heart, and it actually can cause cardiac arrest as well. So at the very extreme, eating disorders actually can cause death. I mean, this is very, very extreme, but it's worth mentioning.
So how do you approach treatment for adolescents? And what if they are resistant?
Just for everyone out there, all parents out there, they are going to be resistant. Don't get a shock if your adolescent is resistant. So resistance and ambivalence around treatment is part of the eating disorder. So I just think that's so important to say, because often parents will approach their child and they will, it will start an argument. There will be a lot of fight around recovery and the eating disorder and treatment, particularly at the very start. There's something at the start that we sometimes call the honeymoon period, where the person is experiencing the benefits, quote unquote, benefits of the eating disorder. They're losing weight. Their friends are telling them they look great. They're feeling fantastic. At the beginning, you kind of get this adrenaline surge where it's actually sometimes called the anorexic buzz. That's what our patients sometimes call it. So at the beginning, most people just have no interest in talking about recovery or the eating disorder or treatment. So it's good to expect that. When you do approach, if you do approach your adolescent and you want to talk to them about it, you want to do it in a way that is incredibly gentle. So there's something actually called the Maudsley Animal Carer Models. Okay, so the Maudsley is a hospital in England, and it has a fantastic eating disorder unit. And there's lots of they use animals to describe different styles of carers or parents. So you've got the terrier who's always kind of nagging and, always telling their child to eat. You've got the ostrich, a parent maybe who sticks their head in the sand and doesn't ever talk about emotions or feelings. And the ideal approach is the dolphin. It's very, very gentle. It's soft. It's gentle nudging. It's gentle guidance. If you approach someone with an eating disorder with fear or panic or anger, you are going to end up locking horns and you will be in a battle, and you will actually strengthen the eating disorder. It's like throwing petrol on a fire, really. So the approach is very, very gentle. It's actually more important how you say what you say than what you say, because you're not going to say anything perfectly because it's impossible. You probably are going to say the wrong thing. It's the tone in which you speak to someone, and it needs to be very gentle. And if you notice there's a battle starting, back off, really, just don't push, because if you push, you will strengthen the eating disorder.
So what's the importance of early intervention and the impact that it has on the recovery generally?
Basically, it's just really important. So, as I said, there's this period of time, the honeymoon period, where you're not going to get anywhere with intervention. It's very unlikely that, in those very early months, maybe even the first year, that you're going to make much progress. It sounds awful, but in a way, people need to get to a point of some level of suffering with the eating disorder before they want to make changes. That being said, as you want to intervene as early as you possibly can manage, maybe a year in or a year and a half, you really, the earlier that someone has treatment, the better the outcomes. And we see this time and time again. And it's because there's something called the eating disorder mindset, which is, it's basically, if you think of all the thoughts and feelings and behaviors that people experience with an eating disorder, the more people experience those thoughts, feelings, and behaviors, it almost creates this whole other, like a mindset, like almost a different part of the person, which we call this the eating disorder mindset. And the more you've repeated the eating disorder thoughts, feelings, and behaviors, the more entrenched that mindset is. So it's harder to work with. You're more used to experiencing these thoughts, feelings, and behaviors. So if you can catch someone relatively early, when this mindset is quite quiet, or it's only been running for a year or two, then you're going to have a much better treatment outcome.
Okay. What advice would you give to adolescents who are struggling right now with an eating disorder to try and improve their body image, or what they can do to help themselves not get into an eating disorder mindset, I guess?
Yeah, I mean, early intervention, just seek help, it's quite hard if you're talking about just trying to help themselves. It's quite hard if you don't have someone to support you, because once the eating disorder mindset is rolling, it's quite difficult to not get stuck in it, and not get trapped by it. So I think seek help as soon as you possibly can. And, even if that's just a one-off appointment to talk to someone who has some experience of eating disorders, and it can be anywhere around the world these days, can't it? Because everything's online. So, it doesn't even have to be in your own country. So seek help, talk to people, be honest. If you really want to try to address things yourself, you want to start to, if you've got into unhelpful patterns where you're checking your weight all the time, if you're monitoring your body, you want to start to reduce those types of behaviors. But again, that's quite tricky on your own if you've got trapped in that mindset. Yeah, I think that's it, really. I think just seek help, talk to someone who knows what they're talking about with eating disorders, express how you feel. Don't go through it alone, because eating disorders can be very lonely, and secretive. Often people just feel very isolated. And then, of course, that's not helpful at all. So
should we throw out the scale?
Well, in treatment, we do actually check people's weight. So no, not if you're in treatment. If you are just obsessively monitoring your weight, then yes, maybe ask someone. We ask people sometimes to ask a partner or a family member to put it away, hide it somewhere. But you don't want to get into body avoidance either. So say you're hyper monitoring your weight on the scale, that's going to obviously cause you problems with your weight shape concerns. But then if you start avoiding seeing your weight, what happens is you start to become terrified. Oh my God, what is going to happen if I step on the scale? And so it's tricky with the scale. I think neither hyper monitoring your weight nor avoidance is helpful.
What's a healthy amount of weight measurement? Like,
oh, it's tricky. I mean, our patients would check their weight once a week. It's maybe that's healthy. I mean, you could debate that that's even a bit too frequent. It's not so much the frequency, it's the feeling around it. We're wanting to get people to the point where, in all honesty, most people have some sort of emotional reaction when they step on a scale. It's just our culture. I mean, I'm talking global culture, isn't it? But we're wanting to get people to move from terror and panic, and then they'd restrict their eating if they see the number change, to, just okay, maybe a bit of mild dissatisfaction, just no big deal really, is so it's less about the frequency, it's more about how you relate to the number.
How can we as a society change the mindset or change the way we look or think about the body image and the weight?
I think, again, we need to just move away from focusing on it so much. This body neutrality idea, which I know seems quite mind-blowing because we're not used to being neutral about our bodies. I think we just need to, it's a big ask, I know, but take focus away from weight and shape. I don't know what that would look like in reality. Maybe it would be, there would be some sort of rules and regulations around social media, even rules and regulations about magazines. Maybe we had kind of education in schools about weight and shape concerns. It's really hard to know as a society how we could change this, what's kind of like this big juggernaut of a train, how we can really intervene with it. But I think we basically need to move away from focusing so much on our bodies. Maybe we could work towards just really looking after our bodies, just celebrating them for all of the amazing things that they do to us, without us having to have a value judgment based upon what we look like. So yeah, I suppose it's in our language, the way we talk about our bodies, the way we have messages around our bodies on social media, on TV. I think it would be all of those things. And the nutrition piece, I think I feel that that's important as well, just for us to move to a place where we're just really kind of nourishing this lovely machine that we live in, and that it's celebrated rather than us kind of evaluating ourselves based on what it looks like.
I just thought of something randomly now, because my daughter plays synchronized swimming, right? And I'm sure with ballerinas as well would probably have the same issue. Any sport, like you were saying, there are specific sports that require a specific body weight, right? My daughter doesn't necessarily struggle because she's super skinny. I don't know. We feed her, but she's just sometimes people question us about that.
Yeah.
But I do know that a lot of girls are struggling, right, with their weights, and the parents want to do their best to be supportive of their children's body image, right? But the sport demands them to eat in a specific way, right? So how do they
difficult,
how do they strike that balance to make sure that they're not encouraging them to end up with an eating disorder?
It's really difficult. It's really hard. If your sport, it depends how extreme the sport is. I mean, if the sport is, I've heard of some people in particular sports where, they've had to severely restrict their eating in particular sports. Like I said, gymnastics. I don't know if it's the same in synchronized swimming, and I'm not sure I'd ever think that's a good idea. I'm not sure you could have the influence of that sport and then just go home and eat normally, because the thing is, if you are severely restricting your eating from a sport, which I think is what you were kind of saying, if you're really having to restrict your eating, we're very used to thinking, aren't we, that our mind impacts our body. And that is true. If we have distressing thoughts, that really impacts our body. But our body so powerfully impacts our mind. So this is what I was mentioning, I think, right at the very start when I talked about starvation syndrome. If you are severely restricting your eating and that results in your body weight dropping into a kind of unnatural level, and even if that's related to a sport that you've got involved in, you will start to think differently. So your body really starts to impact your mind. You will become more detail focused. You will become more preoccupied by thoughts of food and eating. You can actually I'd go as far as saying you could almost create an eating disorder. You can create that mindset by changing what you're eating. If you starve someone, they'd start to develop what looks very like an eating disorder. So I think it's a very long-winded way of saying, I think it's really difficult. Truly, if you had a child that was in a sport that was actively encouraging focus and distress, focus and hypervigilance around weight and shape and restricted eating, and then at home you're kind of trying to give the message where, oh, it's all fine, you look great in any size or whatever it is, and eating normally. I think that's a really difficult thing to do. And whether that means that children don't engage in those sports, I don't know. But it's really mixed messages, isn't it?
So at the end of each episode, we have like a closing tradition that we like to ask our guests for two things. One thing that your parents did and that you're very grateful for, and one thing that you wished your parents would have done with you and they didn't.
I'll mention my mum because she was my, the parent I was closest to. And she actually passed away about 10 years ago. So if I talk about her in past tense, that's why. My mum was particularly good at letting me feel my emotions. So whatever, however I felt as a child, if I was angry or sad, I always remember my mum just giving me a really big hug. And once I'd calmed down, we would just talk about how I felt and what had happened. And I really, really appreciate that because it has led to me being not scared of my own feelings and not scared of other people's feelings. And that's just been such a gift. As I got older, this might sound kind of totally contradicting what I've just said, but as I got older, I think my mum really struggled to break that kind of parent-child relationship. I think she struggled for me to become an adult, and she became quite critical of some of my decisions. And I think she really struggled with that. So I wish she had been, I don't really know how she would do this really, but, just able to move from that kind of parent-child relationship to more of an adult relationship. She really, really struggled with that. So I wish she'd been able to do that.
Julia, thank you so much for today. This has been really helpful, and I hope this starts raising some awareness to some parents who don't see the signs in themselves or in their children. So it was a pleasure and very, very insightful information.
Oh, thank you. Thank you for inviting me onto the podcast.
Thank you very much. Thank you, everybody, for listening in to our episode today, and we'll see you again on another episode of Nest Podcast.